Yep, you're on.
Okay.
All right. Ready? All right. Good morning, everyone. We are Acta. So in 2016, Acta co-founder Jared Grayson's his sister Heather Grayson passed away after a 6-month battle with cancer.
6-year.
6-year battle with cancer. I apologize. And over the course of those 6 years, there were hundreds and hundreds of medical visits, and each one of those visits required the latest in medical histories. This often created difficulties in coordinating care, and it also created problems in terms of delaying her care. So we got to thinking about this problem. What's really happening here? 370,000 providers use electronic health record systems. And yeah, all right. 370,000 providers use electronic health record systems. So the data is out there, but the problem is that this technology is being used the same way as the old paper file system. So this isn't a data availability problem, it's a data connectivity problem.
So as Michael said, it's a connectivity problem. So Acta is a data connectivity platform. It seamlessly links our customers together to reach one common goal. So on one side you have our patients, those who use our platform via the free mobile app to get better now. On the other side, you have healthcare providers, those that subscribe to the platform in order to ensure they have better outcomes for their patients. Acta bonds that lack of communication between EHR systems currently employed by the nation's largest and smallest medical institutions. So, how does it work? The patient logs on to the mobile app securely. From there, they then choose which healthcare provider will have access to their medical history and swipe. Automatically, that healthcare provider's EMR is updated with that patient's most up-to-date medical history, which gives them a starting point for their care delivery. If that healthcare provider then makes updates within their EHR, our platform is automatically synchronized with that up-to-date medical history, giving better access and treatment and transparency for that patient's continuity of care. So, Acta is a HIPAA-compliant data portability platform built upon our proprietary smart contract logic, which allows for the transferring of electronic health records between differing EHR platforms. So as I already said, the patient gets to log on securely, choose who has access to their medical history, and with that, Acta brings profound change in enabling care. Now with Acta, it facilitates a more seamless and a better equipped healthcare provider by ensuring better treatments and diagnostic protocols while limiting the healthcare provider's liability as well as malpractice. Acta bridges the data gap. Acta bridges the data gap that is currently exists by allowing our, Acta bridges the gap in technology by granting patients and physicians instant access to healthcare records. It facilitates physicians developing plans of care faster. It aids physicians to get better outcomes and supports lowering physician malpractice premiums. So how does it currently work? So currently when a sick patient goes to a healthcare provider and then they're transferred on to a specialist, they need to bring their medical history. They need scans, documents, all of these things need to be brought over either by hand, they need to be scanned, faxed, and there's an inherent delay that's associated with this. So this can lead to poor treatment outcomes, poor diagnostic protocols. Well, Acta solves this by allowing everything to happen seamlessly and instantaneously. Acta helps to transfer and to facilitate sick patients to carefree patients.
Okay, so let's analyze competitors. Now we have three main competitors, and they are WebMD, Microsoft, and Patient Ally. But all of them are automating a broken processes. So upon those broken processes, Acta was built. So in Acta, everything is simple and easy. You know what? We are different. You just grab your phone, go to the doctor, and everything will be settled. You don't need any paperwork or something like that. Just it's simple and easy. So next.
So what we have in mind here is a 6-month time to market. So during that 6 months, we'll have a platform development activities where our development team is producing the connector and mobile app logic and the essential logic that's going to hold this data in a central location, and also working toward getting the compliance necessary to contain this type of data. While those development activities are happening, our marketing team will be developing the website and the brochures, while also forging partnerships with key organizations such as the American Cancer Society, American Society of Clinical Oncologists, and so forth. Our sales team is going to focus on 2 initial target markets. We're looking at the oncologists, and we're looking at continuing care retirement communities because of the base that this allows us to grow in terms of we've got 2 customers we have to deal with. We have customers on one side of the platform, we have customers on the other side of the platform, and this allows us to grow both sides of that platform equally. So that pre-sales period is going to offer steep discounts to early adopters to this platform. Once the platform is done and our compliance is in place and we're ready for product launch, the marketing team will kick off with a social media blitz, and the sales team will transition into the active sales mode.
All right, so I'm going to talk to you guys about a little bit on the financial side. So what will it take to get this business off the ground? As you can see from here, we're seeking $900,000 as venture capital. We're bringing in $50,000 in loans, and hopefully we'll have some grants to add to that pool. How are we going to use this money? So as you can see from the right-hand side, we're going to spend a lot of money on building the platform itself. And then we do have some, sales and corporate overhead, and that's just to build the foundation and do the pre-sales and try to get more business in our pipeline. We also have $118,000 in reserves for contingencies. And here are some of our projections. As Mike pointed out earlier in the presentation, there's an opportunity of around approximately 370,000 providers, right? So, and that provider pool is growing. That's about 70% adaptation of electronic medical records. So based on that, what we did was, kind of came up with a forecast of projecting out 4 years and where our revenues are going to go. So what we're targeting here is first year, we're not going to break even. The second year, we'll start breaking even. And from that point on, we're projecting the sales to grow on. So the target market is only 14,000 providers. So that's a 3% share, based on a 3% share. And we're targeting at year 4 revenues of $98 million.
So here's the team. As myself, I've had 16 years of previous experience with a technology startup as CEO. There's Jared Grayson, who you've met. He's got 10 years of experience in medical device sales. Rashid Hashmi, right here, 12 years experience as a CFO of an international trading company. And Peggy Ma has experienced technologies, proven track record of delivering solutions for data-enabled teams. Teams that are producing data-enabled solutions. So that is our presentation for today. Thank you for your time.
Thank you.
Questions?
Yes.
Yes, sir.
Of the hundreds of different EHR systems out there, there apparently is very little compatibility between them. That's one of the big negatives on Obamacare is they didn't require standard data in all the different EHRs. So that's an opportunity for you.
Yes.
But also because there, I don't know, maybe it's over 1,000. I don't know how many. How many of those are you going to learn? are you going to master connecting to each other? Because and it's a moving target. They're always changing all the codes within each of these
Absolutely.
1,000 or so EHR systems.
We're targeting the big three at the first.
The big
get-go.
three.
Yes. So Epic, Patient Allies, like they've got a system, but that's toward 15. But there's over 100 EHR systems out there, as you know, and there's
So
a
you're
lot
just
of.
going to do 3.
We're going to start with the first 3, and then we'll try to grow out there based on that. But as you get to the position 15, you're looking at maybe 1% of the total market.
Have you tried to connect to yet? Is it really possible?
With the web services, we've gotten some success being able to try to, in playing around with some of the connections, but we're just prototyping at this point.
I guess that was the question I had, is a lot of companies have put their shoulder at this problem, but it's
Yeah.
technically totally feasible.
Yeah.
Operationally, getting the big three to cooperate stops virtually every venture that goes down this path. So I don't know if you had inroads there. I know you have some experience
Well,
in selling to that market.
There's some positives in that front, in that there was a law that was passed in December 13th of 2016 that forces them to comply, and if they don't, you have a path through the Office of Inspector General at NIH. So Health and Human Services can help drive some of this, we're hoping. But we think that if we can cover the big three, we think we're going to be in pretty good shape.
So maybe I missed it, but who is, for your revenue model, who's paying you?
On the provider side,
Is it those 3?
No.
No.
The doctors.
So
doctors.
The doctors.
So you didn't speak a little bit about that? I mean, how they're going to pay, what's the model there?
So I said it was a subscription-based platform, so the physicians are the ones that subscribe to our open platform, and they will then give us our revenue.
So on that note, one of the things is actually I've used Microsoft Health Vault, and there's Patient Fusion, and there's 2-3 other things out there. And the thing is, this is one of the things that I think the problem is legitimate, but the thing is, all of the solutions I have, they all seem very disjointed, and you don't have necessarily all of the doctors also buy-in. So have you done any either surveys or testing, either among doctors or patients, of this app? And so do you have any use cases that you can speak of?
it's been a little bit doctor heavy. We've started to try to reach out more toward on the patient side, but on the doctor side, we have gotten, our price points are right in line with what they would need for adoption and so forth. But you're right, you have that chicken and egg problem where you have providers on one side are going to be looking how many patients do you have on the platform. You have patients on the other side, how many providers are on the platform. So you have to sort of grow that base on both sides. But yes, you're right. It is a challenge.
So, good presentation, by the way. So that's herding an awful lot of cats in 6 months. You're in your pre-sales 6 month. I mean, I don't know how you're going to do that, and even if you get the money, it just seems extremely aggressive. I don't question if someone builds this, that patients will use it. All right, the general public will end up using it because it's there. But you know, connecting the dots and all the different file systems, and then actually you're going to do a social media blitz to sell to doctors. You know, I don't know if that. Explain how that's going to work. You're trying to do an awful lot in that 6 month period. That I just don't know how. You know, God bless you if you can pull it off, right? But because this is a really interesting space. But just comment on that. I mean, you're really trying to cram, and that was the timeline, right? The pre-sales 6
Yes.
months after funding, or.
Yes.
So I don't know how you're going to pull that off.
Go ahead.
So, you know, I was going to answer that by saying that, you know, we're trying to build up parallel efforts, right? So you're developing the platforms, you have sales folks out there, you know, trying to sell to providers. And then you'll have, you know, some of us working on the technology pieces, right? So the APIs, how do we connect them with the different vendors and all that. At the moment, it's kind of hard because, you know, those vendors really don't want to expose that kind of information to us at the moment because we haven't even really launched, right? So we're hoping that building those partnerships and collaborating with them will help us get to where we need to. So yes, I agree, it's kind of aggressive, but we want to take a pretty aggressive approach to see where we can.
Yeah, I mean, you guys might want to think about it. Your sales cycle is going to be at least 6 months to just crack the first. I mean, it's going to take you 6 months to wine and dine and finally break through.
After you have a demo.
Yeah,
After you have a
True.
demo.
There's just no, I mean, so you might just want to think, I'm just giving you some constructive feedback. I
Appreciate it.
Thank you, we appreciate it.
Absolutely. And we are lucky that we do have existing relationships with AAOS and the American Cancer Society and also some of those large outfits that will help to push our idea.
Do you know for sure that Epic and Cerner and the big EHR companies will give you their proprietary information on their file structures and codes and everything?
Their interfaces are published.
It's all public?
Yeah, we've got it
All the
published.
APIs, all the webs, it's all web services.
It's all web services.
Good.
Can you talk a little bit about, you talked about like HIPAA compliance, right? And as we all know, with EMRs, EHRs, privacy and security is like the biggest crux of the whole thing. In fact, I'm a cybersecurity expert. So I just want to understand, how are you guys are focusing on that? Like, how is this HIPAA compliant, right? Can you talk a little bit more about that?
Well, there's a CMC certification that we're going to obtain, and everything is crypto key locked down. Every bit of data that's pushed out, and the other side of it is we're not just going through mining every single bit of data that's in an EHR. You've got to have that patient on one side saying, yes, I want my records over here, and you've got to have that provider on the other side as being on the platform. So it's really in the crypto keys, as Peggy could, I'm sure, tell you that it's all in that, and how we key it all up.
So if the APIs are open from the big three, and this is, it's clear that other competitors can exist, where is your competition? And you guys said that the smart contracts, I think, is what makes you guys so unique. Tell me more about that. Tell us.
Well, actually, I think, the technology is there. And have you seen the website of those three competitors? In their privacy policy, they said they will use the data of the each users. So, well, I mean, if the company wants to use it, well, it's safe. But if someone intentionally wants to use the data, it's not safe. Okay.
Thank you. Time is up.
Thank you.
Thank you very much.
You guys.